Welcome to another episode of Med Madness, where we delve into critical topics that matter to healthcare professionals and medical students. Today, we're exploring a condition that poses significant risks during pregnancy, pyelonephritis. Pyelonephritis, an upper urinary tract infection, becomes notably more common in pregnant women. This increased incidence is largely due to several factors, including the heightened risk for recurrent asymptomatic bacteriuria and the natural immunosuppression that occurs during pregnancy. Next, let's discuss how pregnancy-specific changes like progesterone-induced ureteral dilation, laxity of the ureteral valves, and bladder compression from the growing uterus facilitate the ascent of bacteria from the lower to the upper urinary tract. A variety of pathogens can cause pyelonephritis, with Escherichia coli being the most common culprit. Other significant pathogens include Klebsiella, Enterobacter, and Group B Streptococcus. These infections can lead to serious complications if not managed properly. For the mother, the risks include preterm labor, low birth weight, and acute respiratory distress syndrome. The fetus, on the other hand, faces risks such as preterm birth. Next, let's examine the clinical presentation. Clinically, pyelonephritis in pregnancy can present with symptoms initially resembling cystitis such as dysuria. However, it often progresses to more severe symptoms including fever, chills, back pain, maternal and fetal tachycardia, and costovertebral angle tenderness. Diagnosis is confirmed through urinalysis, which may show leukocyte esterase and blood, and urine culture, which helps identify the causative organism and its antibiotic sensitivities. Given the high stakes, management of pyelonephritis in pregnancy requires a proactive approach. Pregnant patients with this condition should be admitted to the hospital for close monitoring and treatment. Empiric intravenous antibiotics, such as ceftriaxone, are initiated while waiting for urine culture results. Once the patient has been febrile for 24 to 48 hours and shows symptomatic improvement, they can be transitioned to oral antibiotics tailored to the culture and sensitivity results. Next, let's talk about the role of imaging in pyelonephritis. Imaging, though not routinely necessary for diagnosis, plays a role when the patient's condition does not improve with standard antibiotic therapy. In such cases, a renal ultrasound can be used to check for complications like nephrolithiasis or renal abscess. It's important to note that physiologic hydronephrosis is common in pregnant women, which could be mistaken for a pathological condition, leading to unnecessary interventions. Now, let's look at a real-life case study to bring these points into perspective. Imagine a 28-year-old pregnant woman in her second trimester who presents to the emergency department with a history of dysuria, fever, chills, and severe back pain over the past 2 days. On examination, she has maternal and fetal tachycardia and marked tenderness over the costovertebral angle. Urinalysis reveals the presence of leukocyte esterase and blood, suggesting a urinary tract infection. Given her symptoms and clinical presentation, she is diagnosed with acute pyelonephritis. Recognizing the potential for severe complications, she is admitted to the hospital. Intravenous ceftriaxone is started immediately. Over the next 48 hours, her fever subsides and her symptoms begin to improve. Subsequent urine culture confirms Escherichia coli as the causative pathogen sensitive to the antibiotics she has been receiving. After remaining febrile and showing significant symptomatic improvement, she is transitioned to oral antibiotics for the remainder of her treatment course. This case highlights the critical importance of prompt diagnosis and aggressive management of pyelonephritis in pregnancy to prevent serious maternal and fetal complications. Thank you for joining us on this episode of Med Madness. Stay tuned for our next episode where we will continue to explore important medical conditions and their management. Don't forget to leave your comments and share your experiences with us. Until next time, stay curious and keep learning.